The medical case, Dania Șelaru, would sound like this. Mother died at the age of 29 in 1983 of breast cancer. And in 2012, I was diagnosed with a tumor, a cancer in my right breast. It was half a centimeter large. It was one lymph node invaded, estrogen and progesterone positive, HER2 negative, and no metastasis, fortunately. And I had a surgery in the month of July, and it was followed by 8 cycles of CE, if I remember correctly, and Taxotere. And I had no radiotherapy. Now, what is it so relevant about this story? Because I'm sure that it resembles many other stories. What is relevant is that I had a reconstruction, and I am grateful forever to the professor and his medical team for the extra effort that they put in that surgery. Yeah? It was an immediate reconstruction using Becker 35 expander. And simply I think that reconstruction, that surgery helped me become happier and stronger. And this is what I want to share with you today, the impact that may have on a patient such a surgery. And I realize now, because I remember the day of the surgery, that it took 5 hours. Some other patients were not having the surgery in the last day. So it was quite of a headache, and also the recovery. And this is why I say that thank you again for the extra effort. Now, the cancer is a very pervert disease. And I think that breast cancer is a very, very pervert disease, because it hits the woman at all her layers as a human being. I used to see myself as having layers. You know, I'm a professional, I'm a wife, I'm a mother, I'm a woman, I'm a body, and I'm a spirit. And most probably, only the spirit has, in some cases, something to gain out of this disease. Because you may know, some of the patients become better and become stronger, and I think that I'm part of that group of people. The rest of me had only to suffer from this disease. This was clear. As a professional, I was, asking myself, will my colleagues and customers pity me when seeing me without hair? Will I be able to do the same sales job, which is stressful, at the same level of performance, or do I need to look for another job where I will earn less and have less challenges in my life? As a wife, I was 38, somewhere between youth and maturity. And of course, there are concerns. You may think of your husband going for nicer and younger women. And unfortunately, I learned that divorce is something common for women who have this disease. Because probably some of the men are selfish, looking for their happiness, but to be very fair towards them, also women turn to the worse during this. On the other hand, if you don't have this problem, because fortunately I have a very healthy and happy marriage, I can tell you, menopause is not something that helps, the romance and the passion in a relation. So there are problems. As a mother, I'm a special type of mother. I'm a stepmother of a kid who lost her mother because of cancer, at the age of 3. And imagine how was, the thought of having my kid losing 2 mothers because of cancer. So it was I would say, I couldn't understand, couldn't bear such thought. On the other hand, as a mother, a mother-to-be, you ask yourself if you will be able ever to give birth to a child. So there are other questions. Now, as a woman, I always, like to dress nice. And I was wondering, do I need to change all my wardrobe? Will I be able to run freely, to swim freely? Do I need to take care each time I bend, I run, I dance? So on and so forth. And of course, all these questions were only hiding other questions. Will I die? Will I survive? Will I survive 5 years? And the question is, 5 years is a long period of time or a short period of time? Because it's not clear, but everyone talks about the 5 years, And then, okay, if I don't die, will I survive? Will I have a recurrence in 1 year, in 20? All in all, because I don't want to continue with the list of questions that were spinning around in my head, my point is very clear. A woman having this disease only becomes hairless, uglier, weaker, and more vulnerable. And having all these in mind, all these questions in mind, because all these questions represent battles that the person has to go through in the following years. Yeah, it depends on the thing that it's gonna change her lives. There are challenges, battles, call them whatever you like, but the life will change at any level. Yeah, and having all these things in my mind for, I think it was 1.5 months until from the first alarm in an ecography until the surgery, I went to the professor one day before the surgery asking for a reconstruction. And this is the reason for which I think I wanted to share the story with you. Because I know that the thought is, when you hear such a person, that the person is reckless, is ignorant, is superficial, looking only for the physical appearance. Yeah? And my point today is that it's not so. So I was very clear of all the battles that I had in front of me for the following years, and I just wanted, the thought that I had was that I want to go over some of these battles, yeah, to park some items, to tick some boxes, to know that part of the suffering is solved already, yeah, and the suffering will be less in the future. This was actually the thought that I had in that day when talking to the professor. And I kindly asked him, of course having health in mind as a first priority, to do a reconstruction if he could do it. In that evening, I prayed to God. I'm not a very religious person, but I know that God is there, and I trust Him. And my request to God was, God, please do the best and inspire the professor to do a masterpiece. This was the term that I was using also when talking to my husband, daughter, friends, so on and so on. Masterpiece. I wanted a masterpiece to get the maximum out of the situation. And somehow the thought went to the professor, because indeed he did a surgery of which I think he is very proud of. And what is important to take out of this story is not only the physical and social impact on my life, which was good, but it's also the spiritual and psychological impact of the reconstruction, because somehow it gave me the feeling that God is there, He listens, He helps me, and somehow I'm controlling just a bit my life from now on. And what is important is that somehow the motivation to go through the entire journey of the cancer treatment was based on this reconstruction. Yeah, it was my will, and I think that any patient needs to have their wills, yeah, something to give them strength to move forward. And this was giving me strength. And now, in the end of what I wanted to share, to come back to the term beautiful in the title of the conference, I think that beauty gives somehow the measure of society and how civilized it is. Because a society which is not civilized, which is primitive, definitely do not respect life. And a society that is more civilized respects life, but also beauty. And I think that us Romanians are somewhere in between. We put a lot of focus on survival and health, which is good because it's definitely the most important. But we need to start thinking of beauty as well, because it helps people become stronger and happier.